All right. Hello, everyone. Thank you so much for joining us here this evening. My name's Morgan. I'm the Practice Development Manager for Western Canada for Acorn Biolabs. So lovely to meet you all, and I'm happy to be here with Dr. Foster and then Dr. Taylor, who is Acorn's CEO. We're going to give you a bit of an overview about Acorn today, the background, how we started, and then also both the service and the product that we offer, Secretome. So let Dr. Taylor get started into that, and then we'll finish off with some Q&A at the end.
Thank you very much, Morgan. Excited to be here and excited to share the virtual stage with Dr. Foster. We're certainly ecstatic to be working together to bring you this very innovative and new technology. So essentially, I'll cue up a little bit about what we're doing, and then I'm very excited that Dr. Foster will be able to share some of the real world experience of our product live. For my, for my part, I really just want to introduce you to the future of regenerative aesthetics and let you know that it is powered by you, your very own cells. Acorn is a company that is really devoted to making sure that you have the most safe and efficacious opportunities to leverage your own biology in this new exciting era of regenerative medicine. We've started for working in this space years ago. In fact, the company has been around creating these things for 8 years, but the research goes back into University of Waterloo, University of Toronto, and a number of other institutions where we've really brought together some exciting and innovative technologies to allow us to capture the best version of you to use in cell-based and medical treatments today. Talking about cell-based treatments, it is a pretty exciting era that we live in. This is the world of regenerative medicine. In typical pharmacology, we're grabbing a chemical or a compound, and we're manufacturing a drug looking for purity of that compound in the laboratory. In regenerative medicine, it's all based on living material. It's based on cells. And so the next currency in your healthcare will be your very own cells. And so that is something that we've seen start right in the world of aesthetics, where your cells are really the template and the starting point to deliver value back to you. I have to give Kim Kardashian a little bit of credit here. She did make the vampire facial very popular and introduce people to the world of PRP or platelet rich plasma, where essentially we take your blood and use that to deliver growth factors and nutrients back to your skin and hair. That's something that is part of what we've really innovated on top of and created other opportunities for you to leverage your actual stem cells to create these materials from. And those same stem cells, this next currency in healthcare, can also act to really be a template for the future. And we see amazing innovations going on around the world where cells are being used to treat genetic disorders, are being used to treat diabetes and beyond. So if we think about what we do at Acorn, it's really two things. We want to make sure that we capture the best version of you and we lock that in place. And that is our concierge stem cell collection and storage service. This is taking the cells from you non-invasively, and we'll get into some details there, but we collect these cells in a very simple way and then cryogenically freeze those down in liquid nitrogen. This is negative 196 degrees Celsius, so only about 10 degrees warmer than the surface of Pluto. And at that low temperature, your cells will not age another day. They're literally frozen in time. No cell metabolism, no free radical damage, nothing is running, and so they will stay that same age indefinitely. On the other side, we develop strategies to leverage that value that you've locked in place and actually use those cells to deliver value back to your own skin, hair, and in the future, sports medicine, disease prevention, and more. It has been an exciting run for us. There's some people that have been exposed to the value of leveraging their own cells and have actually become clients and members of the Acorn Squad. So people across sports, biohackers, and even celebrities are jumping on board the value that their own cells have inherently. And it's been really exciting to watch Acorn really start to take over and exceptionally excited to be able to offer this to everybody on the webinar today as well. I don't know a ton about that celebrity world. What I do know a ton about is a lot of the work that we're doing in the laboratory, and so I'm really excited to share that we have established partnerships across some of the top institutions across Canada and now into the United States as well. and even internationally, where we are co-developing and creating the next generation of cellular treatments. As a snapshot of some of the ones that I think are worth noting, we're currently working with the National Research Council to take the hair follicle stem cells, which we're capturing in this process, and turn them into immune cells, including NK cells. With the University of Toronto, we did some very exciting work on being able to create iPSCs, so reprogram those cells so that they regain their potential. The University of Calgary, we're using those cells to treat cartilage damage and knee pain. And with Mount Sinai Hospital, we've actually created pancreatic progenitor cells on demand, which is the precursor to islet beta cells, the cells that are important for producing insulin as a target for diabetes. At Acorn, this opportunity really creates a personalized cellular reserve, this biologic bank where we can lock in the value of your cells. And excitingly, we do this in a very simple way by capturing those cells from your hair follicles. By simply just plucking the hair follicles from the back of the scalp, we can have this very tiny bulb. If you've ever been combing your hair, it's that sensation when you maybe catch or snag one. And that bulb, that root, is rich in our own mesenchymal stem cells that we target to cryopreserve and then can pull out to actually leverage for treatment across wounds, skin, hair, into injuries and longevity and future applications. These cells really act as a repository to create these from. And you can do it both by leveraging those cells themselves and by using them to actually create very specific things on demand, like exosomes, growth factors, and more. And to kind of give us a little bit of an idea of all of these amazing innovations and how that actually comes together to deliver value to you, I'm excited to pass it over to Dr. Foster.
Okay, there we go. Thank you, Dr. Taylor. Thanks for sharing your knowledge and your time with us. We really appreciate it. And I want to thank all of our clients for joining us today. We know your time is valuable and we appreciate you. So, I want to say, actually, I'm really happy that I've preserved my own stem cells and my family's. It's like an insurance policy. And like Dr. Taylor said, there's a lot of exciting things happening in research, and I can't wait to see what's to come. Okay. So, as for what we're doing with your stem cells today in the aesthetics realm, Acorn has developed a fabulous product, aptly named YOU. Because it's just that, it's made for you by you, from your own stem cells. YOU is essentially a serum. It's derived from your mesenchymal stem cells, as Dr. Drew said, and they're easily collected from your hair follicles, and we do that at Harmony Aesthetics. It contains everything that your stem cell creates and excretes. As you can see from the slide, it's an extremely concentrated serum, and it contains up to 5 billion molecules per vial. I'm sure most of us here have already tried or heard of PRP. We heard a little bit about it already. And in fact, we offer it at Harmony Aesthetics. People do see improvements in hair and skin, but the results are quite variable, with about a 50% response rate, which isn't bad. But we know that our vial of Secretomes contains significantly more growth factors when compared to PRP. That makes it an exciting alternative. Acorn has found that your Secretomes deliver much more consistent results, extending the longevity of skin and hair. It increases hair density, but we'll talk more about that later. As I said earlier, your stem cells secrete a multitude of molecules that can be used in regenerative medicine and aesthetics. There are, of course, the growth factors we've talked about, but there's also exosomes that coordinate intercellular signaling. They're working at a cellular level, telling other cells how to behave. For our purposes, the messages to your skin is to start acting younger, and to your hair follicles to wake up and start growing more hair. I'd also like to point out here that YOU contains PDRN, which we've already seen, made famous. Oh no, sorry, that was a vampire facial. This is different. This was made famous as the salmon sperm facial. Similarly to PRP, many people have good results with it. With YOU, you're getting your own PDRN and in higher concentrations. That provides much more robust results. So, as the motto goes, this is a product made for you, by you. And that makes it exceptionally safe and much more effective than other options that are currently available. such as salmon-derived PDRN, or exogenously derived exosomes that can come from plants and animals, and even your own PRP. We're offering a personalized regenerative option that's not only safe, but delivers consistent results. Currently, we can move, yeah. Currently at Harmony Aesthetics, we're offering secretomes for skin rejuvenation and non-surgical hair restoration. So when it's paired with microneedling, the secretomes get to the cellular level, essentially reducing or slowing the aging process and stimulating new growth. The serum is quite versatile and can also be used topically to help with healing after procedures or incorporated into your skincare regimen. But the best thing to do is to speak with myself or one of our lovely estheticians, Nikki or Lindsay, and we can personalize a treatment plan for you. So at this point, I'm going to turn it back to Dr. Taylor so he can share with all of us some of the results that they've been seeing so far.
Thanks so much, Dr. Foster. I really appreciate that dive into the background behind the product and all of the amazing things that go into it, and also what you're leveraging in practice today and how this really is bringing it all together. The one thing that we're really excited to see is this is a way to deliver back to your tissues some of the things that unfortunately drop off with age and we don't produce in high volumes. And the results show that. A lot of patients are leveraging this in hair, as Dr. Foster alluded to, and we've been excited to see that at day 90, 100% of patients have reported seeing visible improvement in hair loss based on the physician's visual assessment. So from a medical professional looking at the hair of the patient, 100% of patients are seeing improvement at 90 days, which is quite fast for hair. Watching hair grow sometimes is a little bit like watching paint dry. So this is exciting to be able to stay motivated and see some of those improvements. On top of that, when you think about some of the patients, when you look at how they're responding, is when they're in the mirror watching this, as you can see for this young man here, you're seeing results in real time appear before your eyes from baseline to day 60, from then day 60 to day 90, and it is exceptional to actually see the value being delivered over that period of time. In this setting, what the patient was doing is having it's a laser device that essentially opens up channels in the scalp. It's called Carelase, and we paired that with 3 vials of Secretome that were applied at increments across that baseline, and then at 60 day 30, day 60, and that patient would continue in that fashion. This is a woman that had hair loss after having kids, and so wanted to see if they could do something about hair loss that they experienced in their temple. They used 1 Carelase session and added a Secretome vial, very much targeted and concentrated in their problem areas. So along the top of their hairline, in that ridge that they saw a little bit of loss where their part was, as well as on their temples, and came back then obviously, a number of weeks later, and was able to see that growth really thicken up. The hair fibers themselves not only were thicker, but there was more concentration of hair in those areas. So what we're seeing really is that this has the opportunity to really stimulate dormant follicles and wake them back up to start producing keratin again. Of course, we want to talk about skin longevity here. And this is really an effort to not only have your skin look like glass and appear well, but actually perform younger. And so we want to affect the deep layers of our skin and actually deliver that improvement. And so what we like to watch is that the fact that there's visible improvement as early as day 7, after starting treatments. You're looking at much shorter downtimes. 100% of patients are back to normal even after fairly aggressive procedures by day 4, which is important. You want to get back to your everyday lives, and you want to get back to work and all of these things. You can't take too much time off. So this allows you to engage in treatments and know that you're going to be bouncing back and able to get back to your normal day quicker. But on top of that, if you actually track the value that persists over time, you're seeing an improvement in skin texture, skin tone, wrinkle reduction. Skin is being reported that's glowing more, firmer skin. And these visual improvements that you see in the skin persist. 3 months down, you're seeing the same results that continue. And of course, you have this repository, this amount of secretome that you can continue to use in the practice. So it is a very exciting prospect. But like I said, we want to affect the deeper layers of the skin. This is not just about the appearance. We want your skin to actually perform, act, and behave younger. One of the best examples of that is something that is really, I think, a new bar in what we can achieve with topical cosmetic applications and treatments like this. This is actually a Visia device that tracks ultraviolet light damage, sun damage under the skin. Each yellow spot is a concentrated amount of damage that is being picked up by this light. As you can see, by just one microneedling session, leveraging one secretome vial at the time of treatment, and then sending the patient home with one to use for spot treatments over the upcoming days in recovery, this patient was able to significantly reduce the amount of ultraviolet light damage under their skin. This is a new bar in aesthetics and what we can deliver. And this is actually not thinking about the skin as just a topical appearance and how it looks, but by making sure that we're removing the damage that accumulates with age, allowing that skin to act and behave younger, which I think is the next leap forward in how we think about what regenerative medicine can promise. Here's another young woman that ended up doing two treatments in 2 years apart. The same procedure, CO2 laser. They ended up having a pairing with Aquapore as post-procedure care the first time, and then used Acorn the second time. What I love about this is not only that we were able to shave off 2 or 3 days before that patient was able to return to normal appearing skin and get back to normal life, but on top of that, the patient reported that by using Acorn, their skin felt more calm, less tight, way less irritated, no burning. The fear of actually the pain, right, when you're doing some of these procedures can limit your excitement and your willingness to do it, and also the timing. What this patient was ecstatic about was the fact that not only could they return to normal day-to-day faster and not have that red skin appearance and that damage apparent, but they actually felt better during the process, and it made them much more willing to actually engage in these types of procedures and get them done. That was really exciting to see for this patient. And so ultimately, this is a pretty straightforward opportunity. We'd love to have you reach out to Dr. Foster and her team and actually understand a little bit about what a treatment plan could really bring. The first step is really having your cells collected. At that point, you'll officially be timeless. My beautiful wife and I have done this for our children. We've done this for our parents. This is a family affair, so don't just think about yourself. This is something that you can bring the whole squad together for, and really make sure that you all are officially timeless and locked in place. And at that point, now you have the opportunity for some or all of you to then leverage those cells to create, applications today, where you can go back to see Dr. Foster and have your own biologic material, the things that unfortunately we don't produce as much of as time goes on, reinfused into our skin and hair to promote healthy and timeless tissues. So I think this is an amazing opportunity to work directly with Dr. Foster. Obviously, you guys are here because she's the best, and so we're excited to be working with her to deliver this next level of care side by side. I think the one way that I think of Acorn is really as an investment in my future self. I obviously have leveraged my own secretome for my hair. I've done it on my skin as well. My wife does. This is something that we're quite passionate about. But I think when you sit back and you think about these cells, they also act as a biologic health insurance policy. This is something that you are preserving for the future to leverage in all of your skincare needs, but also having these cells locked in place to be leveraged in other applications across other areas of medicine, really like a biologic health insurance policy. And so we've taken the hair follicle cells in our lab alone and turned them into cartilage, bone, fat, obviously skin and hair, but on top of that, neurons, pancreas cells, immune cells like NK cells. This is something that your skin and hair will thank you for. And I think as time goes on, other areas as well are going to be grateful for the opportunity to tap into your younger self. So on that note, I'll pass it back over to share some of the exciting opportunities for all attendees today.
Awesome. Thank you so much, Dr. Taylor and Dr. Foster. Great to hear insights on Acorn, Secretome, and regenerative medicine as a whole. As Dr. Foster said, everyone's time here is valuable, and we really appreciate you making the time to attend today. And so both Harmony Aesthetics and Acorn wanted to extend our thanks and in a special offer here. So all attendees are going to receive a complimentary red light therapy session courtesy of Harmony Aesthetics. It's something great to pair with Secretome and microneedling treatments. And then all attendees will be automatically entered into a giveaway for a free collection and 1 year of banking, which is valued at $1,200. And then for a limited time, when you purchase Secretome within 14 days of this webinar, so effective till May 6th, you'll receive 5 years of complimentary banking, also courtesy of Acorn, which has that $950 value. And so like Dr. Foster said, you can book a consultation with their team to get started there. And then we're going to end off with some Q&A. If you guys go to the bottom of your screen, there's a little option for Q&A, and they'll just be sent directly to the host team here. And I think we already have a few questions rolling in. So I'll direct maybe this one to Dr. Taylor. Is there an ideal candidate for collection and then also an ideal candidate for Secretome, whether it's age or so on?
Yeah, so it's an amazing question. Ultimately, like I said, this is something that we've done across all ages of our family. I think typically you see a hair follicle reach that adult maturity around the age of 13. We've collected our youngest even earlier than that, but 13 and up is a good time, and there really is no upper limit. If you feel like you've got life ahead of you, this is for you. So we don't cap that. We've got patients that have banked their cells well into their 80s, and frankly, when they're in their 90s, their 80-year-old cells are going to look pretty good. So there's always, if you've got time ahead of you, this makes sense. From a Secretome perspective, this is where I think we've really been able to innovate around. Typically, when you think about PRP and some other regenerative applications, they're really like a snapshot, right, of the value that's there. So PRP is leveraging your blood. You draw your blood out, you spin out the red blood cells, and you have that plasma that's rich in growth factors and platelets. But it still is a photograph of your blood. It's a still image. When we take your stem cells into our lab and we grow them out over time, we're amassing much higher volumes of these. It's the difference between really that photograph and like something more dynamic like video. We have the opportunity to collect those molecules over time. And that also is really important for people of different ages, because that process that's more dynamic allows for older cells more time to catch up in the production. Their younger counterparts might have reached those thresholds faster, but in our system, older cells have that opportunity to catch up. And so we're able to actually amass very valuable amounts of these molecules regardless of your age. We've treated patients up to 87 years old using their Secretome and demonstrated clear value clinically. That's a really exciting prospect that has been a big limitation in regenerative medicine before.
Awesome. Thank you, Dr. Taylor. We had one question come in, maybe, I don't know, Dr. Foster, if you want to take this, or Dr. Taylor, but asking how long it would take to start seeing results, both on hair and then also on skin.
I'm happy to share my experience and then pass it over to Dr. Foster. But I see patients with hair seeing results. I think you want to wait, typically 6 months to see. So I'd like to say that, but patients are reporting seeing value in the first 3 months. And so it's a little bit faster of a curve. And I think we just respond to our own materials really exceptionally. And that's why we see that. On the skin, it's almost immediate. You see the healing kick off right away. If you're pairing this with like laser or microneedling, your skin calms down almost immediately after applying it. And that redness starts to reduce almost instantaneously. You'll see the results the next day. And then afterwards, I would say by around day 7, you really start to see the full effects of that value. But part of the excitement is that we're delivering signals that are molecularly queuing up and triggering the production of more collagen and some of these things that take time to actually produce and accumulate. So you'll see some of those effects, tissue thickness, like their skin thickness and things, which is really important. Some of those things will continue to increase out 3 months.
Awesome. And then we just had a question come in asking, in your experience, which treatments pair best with Secretomes to maximize results? Microneedling, laser, or injections?
So most of you already know this, but Secretomes are really new to us. We have an N of 1. We did see immediate results. It was for skin treatments, and we're waiting to see what the hair treatments are like. So I apologize, Dr. Drew, but if you wouldn't mind handling this one as well.
Yeah, absolutely. I think it really depends on what your goals are. We see for instance, the patients that are going under microneedling events, we're seeing fantastic responses from the opportunity to actually have damage reduction from ultraviolet light and inflammation reduction. Many of these molecules are quite small and are actually triggered to be able to be absorbed through the stratum corneum. If you've got clean skin and you're treating clean skin, then you can have an amazing effect without even pairing modalities on top of it. Microneedling and laser also open up channels so you get even more and deeper absorption. And so I think that it's exciting to see those paired, but this really is a versatile option of going with either microneedling, laser, or even applying this topically, either post-procedure or just in general.
Perfect. And then I had someone ask, does the collection hurt? Maybe Dr. Foster, I know you've been collected, so if you want to take that one.
I have been collected. We try to get 50 hair follicles. So imagine we're pulling 50 hairs with a tweezer. I would say it's quite tolerable, but I would expect I think I had about 100 actually plucked because we have to get the right hair follicle. We have to make sure we have a good hair follicle. So it can be a little bit time consuming and there might be a lot of plucking happening. But it's really not very painful at all. Yeah.
Yeah, I think it varies with hair, right? People with longer hair, it tends to be a bit more time for parting the hair and getting at the hair follicle. For someone with short hair, it's unbelievably quick because you're not dealing with any of those things. So for anybody with short hair out there, this is going to be 5 minutes. With longer hair, typically I would suggest about 15 minutes is a typical experience. Everybody has a different level of sensitivity. I think this is unbelievably easy personally. For me, I think there's the alternative of getting access to cells by drilling into my iliac crest for bone marrow is I'll take hair follicles any day. And Jen and I have 3 boys at home. I guarantee you, if there's anything to complain about, we would have heard it. And we didn't hear much from any 3 of them. So I would say if they got through it, then anybody can.
Yeah, agreed. I don't think it's super painful. Just if you've had like your eyebrows plucked or waxed, it's similar to that. I had someone ask here, does it help with sagging jowls? Maybe Dr. Taylor, if you've had any experience with that, you want to touch on?
Yeah, this is a great question. I think that when you're thinking about jowls and things, there's a couple of options, right? And so this is where I think a consultation with Dr. Foster would be a phenomenal opportunity. The secretome can absolutely be leveraged as one of the longer term options to increase the tissue elasticity thickness, which is going to inherently make any other treatments that you're going to select to layer on with that even more valuable. Whether you're thinking about doing spot filler treatments to create some of that lift and volume, these are things that can be done in combination. Acorn really is the regenerative medicine component of that to make sure that your tissues are going to respond the best to this and respond even younger to these things. So sagging jowls is something that comes up a lot. I think it's a multimodal thing where you're going to want to combine some of these things together to get the best results. And the best person to do that is to sit down and talk through and do an evaluation face to face with Dr. Foster to come up with that plan.
Awesome. And then how long does the Secretome serum last? Will it go bad if I don't use it fast enough?
Trust me, you're going to use it fast enough. You're not going to be able to wait to use this stuff. I wish it lasted in my fridge longer. So we keep it in the fridge for a nice long life. This will be stored, at the practice with Dr. Foster. You've got the sleeve essentially of your vials ready and waiting, and you can come in and use them. They have an 18-month shelf life in the fridge. They won't last that long though. You'll be through them faster than that once you start seeing the results and wanting to pair this with other things. And of course, when you run out, you can easily just reorder with us and we'll have them ready and waiting with Dr. Foster for the next time you come in.
Awesome. And then I had a few more questions here. They've done PRP before and the result they found was just okay. Would it be the same with Secretome? Is there a chance to see some better results?
Our expectations are much better. Yeah. Just simply, if you think about the growth factor concentration as something that's like numeric that we can kind of compare the two, the secretome is up to 34 times higher levels. The amount of growth factors is present in your own PRP. That's patient specific.
Yeah, and I think this builds off that question. Are synthetically produced exosomes, do they work the same as the secretome?
Yeah. So this is a question that comes up every now and then. Unfortunately, synthetic exosomes do not react in the same way that biologic ones do. If you think about the secretome, this is thousands of different proteins that our bodies naturally produce working in concert together. In a synthetic system, you have to hand select and pre-select what you're actually manufacturing. And so it ends up being just a handful. And it's very specific. It's a synthetic exosome. I think the value of exosomes, some of these surface proteins that enhance binding affinities and they come with value themselves, unfortunately, just aren't there. And so we see this clinically, right? And it's not only synthetic exosomes versus human exosomes. It's human exosomes from you versus human exosomes from a donor. So there's a big difference between synthetic, but you actually even react better. And this has been documented in 6 different studies now, where you react better to your own materials than you do from a donor's. So having your own biologic reserve is very important if you want maximum results.
Okay, and I think it's our last question here. Maybe Dr. Foster, you want to take this one. It asks if the secretome gets microneedled directly into the skin or if it's applied afterwards.
So the secretome is applied topically to the skin while we microneedle it. So if you've had microneedling done, we usually use something as a slide or a glide, sorry. Basically the microneedling device glides over the skin, and as it makes the microchannels, the serum or whatever we're using can get absorbed into the skin. So it's used at the same time, and then usually we'll put a little bit on topically afterwards as well. And then you could take some home with you and apply it the next day for healing and for added benefit.
Awesome. Well, I think that's all the questions that we had for today. I don't know if Dr. Taylor or Dr. Foster, you wanted to say a few words before we end off here.
I'm super excited about this. Like I said at the beginning, I'm really happy to finally have met Dr. Taylor. And we really appreciate your expertise and the time you've taken to join us. And everyone else, thank you again for taking time in your evening. We really appreciate it, and we will hope to talk to all of you soon.
Amazing. Thank you so much, Dr. Foster. Really appreciate the invitation to do this together. Excited to work together and offer this innovative new technology to all your clients. So thank you.
Awesome. Thank you. And then we'll also have the recording. We'll be able to share that. I think Dr. Foster will share it with everyone afterwards. So thank you so much and take care. Have a good night.